Hi, class. This is part 1 of the lecture on Chapter 9, Speech Sound Disorders in Children. And I first want to tell you that I did not change the syllabus. I had already added in the observation times in the syllabus. I had called them DVD observations, which is obviously not what we will be doing. But I just left the same dates in there. So there are dates in the syllabus for when we will be doing our in-class observations. So Chapter 9, Speech Sound Disorders in Children. According to the ASHA definition, a speech sound disorder occurs when mistakes in a child's speech continue past a certain age. Every sound has a different range of developmental levels for acquisition, which we discussed back in the chapter on development, the age when children are expected to make that sound correctly. So it's not considered disorder until a child is past that age for that sound. Speech sound disorders include problems with articulation, so making individual sounds at the point of articulation. They include phonological processing errors, so production of errors in patterns or in classifications of sounds. We'll talk about all of this in much more detail here in a minute. In other words, the term itself, speech sound disorder, is a big umbrella term referring to any combination of difficulties involving either perception of the sound that then results in a distorted production of the sound, some anatomic or structural difference that again results in distortions in speech sound production, motoric involvement, so involvement from muscle weakness or just some other disability in muscle movement, and then the resulting disorders that come from issues with that fine motor control, and or the phonological representation of speech sounds and speech segments. So this last piece can include things like the rules that govern syllable shape or structure and stress patterns and prosody. I'm going to take a second here and apologize for the glare coming off my glasses. I'm recording in a different room in my house and can't figure out the best place to be. So I apologize for that. Please bear with me. Don't let it distract you. It's distracting me. We add to this discussion about disorder. We'll talk about this in a bit more detail in a few minutes, but the child that's producing sounds differently from cultural expectations. So if our expectation is based on the child's primary language and culture, and now there's a distortion of sound, we can consider some of that disorder, but we have to be able to null that out. And again, we'll come back to that. So speech sound disorders, in older literature especially, you will see them referred to as speech delay or phonological delay, articulation disorder, speech disorder. All of these terms are mistakenly used synonymously. So what is important as you're going through not just this class, but into your next set of classes, is that you learn the distinctions between those things, because they shouldn't be synonymous. So remember that in the chapter on development, we talked about phonological processes being very normal speech differences that occur when children are developing their production of speech sounds, that they only become disordered or become considered disorder if they extend past the age of typical development for a specific sound or specific category of sound. So for example, if a child at age 2 says the word lello instead of yellow, we aren't going to worry about that. That's not a disorder. If they continue doing that at age 4 to 5, it's not self-correcting. Now we would look at that as, is this a disorder of phonological processing? There are some identifiable causes of speech sound errors, disorders, things like hearing impairment, cerebral palsy, cleft palate. Those are very obvious issues that will cause a child to have some or an adult, but we're talking about children today, to have some distortions in their speech production. But for the vast majority of children with speech disorders, the cause is unknown. We can make some really good diagnostic theories about causation, but for the majority of kids, the cause is unknown. So at this point, I need to take a moment to explain that this chapter's topic and the topic for our next chapter will have some overlap. In our next chapter, we're going to be talking about motor speech disorders, those disorders that are very specific to the motor system. And there are overlaps in terminology and in some of the theories behind all of this. So for the purposes of this lecture right now, I'm just going to say that speech sound disorders, as what we're going to talk about today, are not those caused by any motor programming or motor execution, so muscle execution issues. Those things have their origins within the central nervous system. I know that was very vague and kind of brief explanation of motor speech disorder, but I do want you to know you'll hear overlap of terminology a bit. So just to go through some definitions here. The term phonology, if you remember, phonology falls under that language domain of structure. Phonology is the rules of language governing the sounds we use to make syllables and words. Phonology includes the inventory of sounds within a language. And the rules for how that language combines those sounds into meaningful units. Okay, so just a bigger picture of that. When I use language here, I'm not necessarily talking about big global language picture. Like we're not talking about, all languages have content to them. All languages have specific structures, except in the sense that, yes, individual languages have separate structural systems, one of those being phonology. So phonology is present in every language, and we are listing it under those domains of language. But you have to know that when we're considering disorder in the United States, in Southern California, in wherever you are looking at phonology of English right now, standard American English. But we could discuss, I can't because I'm not fluent in other languages, but we could discuss the phonology of other languages as well. Okay, so phonology, the rules of the language that are governing the sounds that we use to make syllables and words. I told you this back when we were talking about language development. For example, we can't combine certain consonants in English next to each other. We never produce them next to each other, but they might be produced next to each other in another language. The term speech sound disorder, I'm going to come back to that again. Speech sound disorder is an impairment of an individual's sound system that results in a significant problem with speech sound production that is different from age and culturally based expectations. Okay, so that's a very succinct definition of disorder. It has to be discrepantly different from what we would expect for a child their age or what we would expect for a child of their language and culture background. In reality, as I said before, the term speech sound disorder is often used as this big umbrella term that covers disorders caused by issues with the whole underlying phonological system or with physical or structural differences, distortions that may cause more simple articulation impairments. We're going to cover oral motor issues next week. Okay, so those motor things. So articulation impairment, phonetic impairment, these are terms, again, you'll see used interchangeably, but however, articulation refers much more specifically to the ability to produce the individual sounds of a language, as opposed to a phonetic or a phonological impairment, which is a disorder of the whole underlying phonological system within a language. So an articulation impairment, this is the child with a lisp. They consistently substitute that TH sound for the S or the Z sound, regardless of the context. At the beginning of the word, the middle of the word, the end of a word, it doesn't matter. That's their substitution. that is an articulation disorder usually. It can be part of a bigger phonological disorder, but if that were the case, it would be impacting other sounds as well. So the child with the W for R substitution. Again, neither of these things are going to have a huge impact on this child's ability to make themselves understood. And that's one of the hallmark differential diagnostic characteristics between an articulation disorder and a phonological processing disorder. So since I used that term, let me explain it for you. Differential diagnosis is what we do as part of assessment or part of testing a child that helps us distinguish one disorder from another. What are the characteristics we look for that separate the disorders? A phonological impairment is one that involves the rules that govern sound patterns within the language. So, in the book, the example is given of a child who has difficulty with word final consonants. The phonological process there is called final consonant deletion. So, this is a child who omits the last consonant of a word. So, the child may say, instead of saying beat, the child may say bee and drop that T sound. Or instead of saying bus, the child may say buh. Instead of saying cake, the child may say K and just drop that final consonant sound. They may be able to say those consonant sounds, the T, the S, and the K sound correctly in other contexts. So if it's at the beginning of a word or the middle of a word, but the end of a word, they drop it. That's final consonant deletion. They have a pattern of error involving a whole structure of phonology, production of final consonants. Typically, an impairment of this kind will involve other sounds, not just one sound, and will have a much bigger impact on the child's ability to make themselves understood. So it's going to impact their speech intelligibility. Another way of thinking about the difference in classification, so we talked about articulation and phonological processing errors. Another way to classify this is in terms of surface representation versus underlying representation. So surface representation is the actual production of a speech sound at the surface level, so at the level of articulators. So for that lisp, we can say the error is the child is not closing their teeth. They're letting their tongue protrude between their teeth. They are not moving their tongue away from their teeth in the correct pattern to produce the S sound, right? That's a surface representation. An underlying representation is that the child is really having difficulty with that cognitive representation of sounds. So understanding the phonological makeup of the language they're speaking, there is some pattern that's missing. So for example, on that final consonant deletion, the pattern that's missing is that you need to close the end of that word. There is a closing sound to the word. Or back to the lisp. The lisp can be part of a bigger phonological problem called fronting. But if that were the case, we would expect